Okay, everyone, welcome 120 podcast. And today I have George Amolo, who's an advanced EMT and works in Kenya. George, hello, welcome, and please tell us about yourself.
Hello, Carl. My name is George Amolo. So I'm currently the acting president of the Paramedic Association of Kenya, and I'm a paramedic student as well. But I'm looking forward to finish my studies very soon. Grateful to be here with you.
Bless
Thank
you.
you.
Bless you. You're very welcome. So, George, it says that you work in Kenya.
Yeah.
Is that as an advanced EMT?
Yes. I was working in Kenya as an advanced EMT because initially uh, I had trained as an EMT because we were using the American system, the EMT intermediate.
Okay.
But later, after some time, I advanced to advanced EMT with the Australasian Registry of Emergency Medical Technicians. So yeah,
Oh,
so
no.
I've been practicing now since I advanced to the advanced EMT. So the current my practice is advanced EMT.
Oh,
Yeah.
brilliant. And what are the key skills within your job role as advanced EMT?
Okay, as my advanced EMT, because basically the role of EMT just remain the same, as you all know, depending on where you work. So as an advanced EMT, maybe just a couple of skills that were beneficial to me. But since Kenya, we don't have advanced EMT role that is regulated, so meaning that my skills were more of like just the same things that I was doing as an EMT, but now depending on your area of jurisdiction, maybe it's where maybe you can find that your roles might be added because since I had worked in the ambulance and also in the hospital, so you find that, of course, the hospital roles might be a bit different with the ambulance roles, but some will be just same. Yeah, like responding to emergency, code blue, and everything just remain the same. But maybe things like to do with ECG, doing ECG on patient, maybe sometimes you are given a role in outpatient department, maybe sometimes you help nurses in taking care of patients with maybe chronic illness, drug administration, and sometimes you take patient to the for imaging and also in ward. Yeah.
Oh, nice. So
Yeah.
your advanced EMT qualification is not recognized in Kenya at this point in time. You work as an EMT, I don't know, you could say B or another type of level, but you think that hopefully you're feeling that it will start to come out and that role will become more established over time, especially as you're the
Yes.
first, right? You're one of the first people to have that role, go there and do
Yeah.
those things. So your skill
Yeah.
set is going to be
And
quite unique.
yeah, and also the reason why I had to do advanced EMT, it's because I was looking at maybe one day I will get an opportunity to practice outside Kenya.
Mm,
Yeah, so I wanted maybe that time when the opportunity come, at least I have some kind of additional skills because sometimes where job takes you, you'll never know. That's added skills might be advantageous to you.
that's true.
And also I wanted to have like dual registration in that I'm like not restricted when it comes to international job market as well. So it was just a strategy that I was using to make things work easier for me.
It's a good strategy. It's a good strategy. It gives you more opportunities, more options. So
Yeah.
yeah, definitely a good opportunity. How do you maintain the practice of an advanced EMT if you're not able to practice all those skills within your job role? How do you maintain that practice?
Okay. How I maintain it is that I make sure that whenever I I have an opportunity, because sometimes based on my experience, even the time that I've been working in the ambulance, you find that where you have been employed, because they do have their own, protocols and
Mm.
SOPs.
Guidelines and
So
whatnot.
yeah, so they were like, sometimes they might increase your job description
Okay.
based on the needs. Because when I was working with MSF, we used to respond to a lot of a lot of emergency.
Mm.
So you find that as an EMT, we were allowed to do certain skills
Yeah.
because of the job.
Yeah.
So having advanced EMT made it easier for me to certain procedures that I was not struggling to practice them.
Gotcha. Gotcha.
Yeah.
That's really good. It's preparation and whatnot. And when you're in that situation at that time,
Yes.
having those
Yes.
additional skills can really help.
Yes.
Definitely. Which type of patients do you find most challenging and why?
The type of patient that for me, I would say ops and gyne, maternity cases to do with delivery.
Yeah.
Have been challenging to me, especially when I have like a mother who is in second stage labor.
Mm.
It's usually like a traumatic kind of event, because the
True.
second stage of labor, it's usually stressful if you're a medic handling that patient. And depending on our setup, Kenya is not like the UK whereby you have a system that is working. So
Mm.
Kenya, sometimes our setups allows you to do extra things, not because like we want, but because since we just have to, because of how our system is. So sometimes we do extra because how our system is. So we just have to, but we are make sure that the patient safety always, of course, must comes first.
Oh, most definitely. And I completely appreciate that a lot of people, a lot of providers, medical providers, especially in the
Yes,
EMS, emergency medical
yes,
services, do get worried and scared or have
yeah,
this have this apprehension of, we're attending obs and gynae patients. I mean, I think it's a very common thing. And I think it's
yeah,
because, there's a lot of reasons for that. One is we're not midwives, so
yeah,
if someone's going to give birth or if someone's going to, at different stages of labor, if something goes
yeah,
wrong, this is where we are challenged and questioned in
yeah,
that certain
yeah, sure,
common sense. So
yeah.
I totally appreciate where you're coming from there.
Thank you.
But I think it's good that you have you ever delivered any babies or had the chance to deliver any babies or help or assist in delivering any babies?
Yes, yes, we did, because the the MSF Medicine Sans Frontiers, because they had an emergency program
Mm.
in the slum area.
Okay.
So their program were majorly focused on responding to emergencies within the slums. So because now you understand, uh, we just have to, because we had so many cases of uh, emergency childbirth.
Mm.
And even we had just knew when a phone call comes in, we just know what type of call we are going to. We had
Yeah.
mapped in our mind, we had mapped,
Yeah, yeah.
this particular call is coming from a certain place. We just know what we are going to expect. So we were prepared even with the phone call from the dispatch.
Right, okay. Yeah,
Yeah,
no,
so
that's
we used to deliver. We used to do it. I've done
wow.
some couple of
That's impressive.
deliveries. Yeah.
In the situations that you would have been put in, that is impressive, that you're able to do that
Yes.
and utilize that skill set to make sure the baby and the mother was safe. So that's
Yeah,
good.
sure, safe. Yeah.
That's brilliant.
And also we used to MSF, we used to have a lot of CMEs regarding childbirth. So we could actually learn and be prepared on how to make sure that the patient we are handling are safe. And
Good.
when it is not safe,
Hmm.
because when the program started, we used to have like EMT and nurse in the ambulance,
Yeah.
but later they changed. Now it was EMT. a nurse would respond like alone in the ambulance.
Right.
Yeah, so
I see what you mean. Well,
yeah,
I'm glad things work out. That is the main thing. I'm glad you was able to adapt to the situation and the circumstance, and I'm glad that you're able
yeah,
to utilize the skill set that you have. That's what's
yeah,
important
sure,
in this job role.
yeah,
What do you,
sure.
George? What do you feel are things that you can improve on in your job role?
Things that I can't prove wrong.
That you can improve on? What are things that you feel that you
Things that
can?
I can improve on.
Yeah, yeah,
Right now, because I'm now, apart from being an EMT, also being a paramedic student, so I things that I can improve on in my job role is just to make sure that I get updated. I make sure that I attend a lot of CPD programs
yeah.
and also research, maybe attending research programs as well, and also just to make sure that I keep on learning and I keep on learning from my seniors as well. And I do a lot of simulations in regards to cases that I do handle most, because through that will increase my competency and also my mental strength and also confidence.
That's true. That's a good point.
Yeah,
So,
yeah,
how do you feel? I was going to ask this later in the interview, but I'll ask it a bit sooner since you brought it up. How
yeah.
easy is it to access CPD training, which is affordable in Kenya?
Um, Access to CPD, most of the time we rely on maybe on certain organized CPD by different organization, be it doctors, be it nurses.
Mm,
So that is when we get in, because for us, would say EMS, since we don't have a structured system or a developed system, we're still lagging when it comes to organizing CPD. And also sometimes I've been organizing even for EMTs and paramedics there in Kenya, because I have close friends.
mm.
Like sometimes I do reach out to them and I explain to them. Then they agree. We have CPD programs. So it's somehow it depends on how maybe you have a network. You can use your networking to organize a CPD. It doesn't have to come from maybe within. Even like right now, uh, through this podcast, maybe I would say if Carl, maybe there is an upcoming CPD, maybe that you are organizing. If there is an opportunity, you can allow us to attend. That's how we maneuver.
It's funny you should mention that, George, because
Yeah,
the company that I'm connected to, that I'm doing this podcast with, provide
yeah, yeah,
affordable and accessible CPD training
yeah.
for staff, especially those under the AHA. Um,
Yes,
and also it can connect and work with others as well that are under like HCPC
yeah,
or different countries and different places. And we're trying to reach
yeah,
out to different people in different countries, especially the low to middle income countries, which is why I'm doing this podcast in the first place. So,
yeah,
if you can ask your
yeah.
colleague and
Yes,
yourself as well, go on to
yes,
120 compressions, the company,
yes,
and
yes,
look at their website and you'll see what
yes.
CPD training access they can give you for a small amount.
Okay,
And
okay.
also another thing that you can take back from this is they provide boot camps as well. They call it boot
Boot
camp.
camps.
Yeah,
Okay,
so they do about 2 or 3 a year. And
okay,
the last one I think was on neurology, if I'm not mistaken. Don't quote me on that. And I believe the next one might be trauma. But either way, whichever the boot camp is that's coming up next, um,
okay,
you're more than welcome and your colleagues to join.
okay.
And
So
it's
I
like
will,
a 3 to 6 hour day where you've got
yes,
people from their fields, people that are experts in their fields that go through
yes,
different
yes.
topics, and you can attend either topic, each topic, one topic, all of the topics,
Yeah,
and that can count towards your CPD as well.
yeah, sure. Thank you. I will let the paramedics know. because paramedics actually we need to be more exposed to a lot of CPD, so
Definitely.
that because it's only through CPDs when we can gain that confidence of attending to a patient
Mm,
without questioning about our skills if you are sure or not sure. So for me, I usually take CPD very, very serious
must do.
because
Yeah.
when I attend a lot of CPD, it makes me feel like right now I haven't been in practice for almost a year since I came to the UK because of the military.
Yes.
But being exposed to CPD all the time still make me feel like I'm still practicing.
Yeah.
Yes. So
Yeah. No,
CPD
that's
is
good.
very, very important. Yeah.
And you did say as well, George, that you do attend simulation-based education also, which I think is really good because
Yeah.
simulation-based education is
Yes.
really moving forward very fast. And it basically, the simulations, I mean, I run simulations as well in my job role.
Yeah.
And the simulations that I run, I try and do it where it's based on a real case or
Yes.
based around a incident that may have happened or
Yes.
a never event, which is nearly an incident that may have not happened. And I try
Yeah.
and basically run the simulation around that so staff can learn from each other and from the actual
Yeah.
event itself and
Sure.
prevent them from making those mistakes before. I'll give you an example. There was a simulation recently on a pediatric patient, and
Yes.
this pediatric patient was down to nothing happened to the patient prior to us running the simulation because it was based on an
Yeah.
event that took place a month or two before. But it was a
Yeah.
never ever event. It was something that almost happened. So,
Yes.
because of the age of the pediatric, you had one group of people in the medical healthcare providing, like doctors, following one guideline, and you had the nurses following another. They weren't following the same guideline, and it's not wrong to follow either
Yes.
guideline, but it's just they weren't following the same guideline. Now, luckily, someone noticed and they were able to all go on the same page and follow the same guideline. However, when
Yes.
we completed a simulation based around that event, we was able to make sure that we gave clarity on what guideline to follow,
Yes.
communication, how to get
Communication.
the team,
Yeah.
way that we communicate to each other. And then after that, they had a patient similar later
Yes.
on, like that week, and they were able to put into practice what they learned in the simulation, and it went
Yes.
very well.
That would even make it easy to maybe even to reflect, to write a
Definitely.
reflection, and now you can be able to, and that is where now and competency comes in, because when you do a CPD, a simulation on a particular case, then you happen to experience the same case with a real patient. You will feel like now you will feel you will feel confidence.
Mm.
Yeah, you will
And competent,
feel
and com
confidence.
and
Yes,
competent.
and
Yeah.
competent. Yes.
And you're doing it in a safe environment as well. You're allowed to
Yes.
make mistakes in a simulation, and that's how we learn from
Yes.
them. A lot of people
Sure.
are afraid of simulations because they feel, oh, what? It's a test, it's an assessment. What if I make a mistake? I'm gonna look really bad. I should know this.
Yeah.
That's not the case. That is not the case.
That's not the case. Yeah, sure.
No, you're allowed to make mistakes. That's what the
Yeah.
simulation is for, to learn from those mistakes. And that's how we treat patients better. That's how we learn to be better in ourselves and how we provide a better service in patient care.
Yeah.
So yeah, very
True.
good. I'm glad you can get behind the simulation-based education type of things. Um,
Yeah, and when you make mistake when doing simulations, sometimes after maybe first, second, maybe third attempt, you will realize that if you have maybe new people who come in to do the same particular simulation, through that weakness that you've been having, it will reach a point that when maybe some people have come in to learn the same,
hmm,
you will find yourself even be the person that is trying to guide them.
that
So
is
you'll
true.
realize that when you start developing that interest of guiding others, that is now when you start becoming competent.
That's a good point. That's a very good point.
Yeah.
And
Yeah.
it's how you prepare for the sim and how you put it together as well. It's got to be put together
Yes.
effectively. But remember, a sim doesn't have to be a scenario. It can be based around a skill. You can run
Yes.
a sim just around, I don't know, let's say cannulation. And you could have
Yes.
questions, key questions around cannulation on what goes wrong, what goes right, contraindications, cautions,
Yeah. Yeah,
Pubitis, and you can literally do it around how many attempts do you get at that skill, and so
yeah,
and so on and so forth, and then you can actually get them to prepare and actually complete the skill in front of you and do it
sure.
in a way that follows guidance, and that itself is also a type of sim. So sims are really progressing, and then you got virtual reality, mixed reality. Have you ever tried a virtual reality or mixed reality simulation before?
What?
Have you ever tried a virtual reality or mixed reality? It's like when you put a headset on and you're actually in the sim itself,
Yeah,
and you've got
okay.
a station, and you've got like two joypads that are in your hands, and you can move the joypads around, and you're actually like you're in a hospital ward, for example.
Oh,
And
no, I've never tried that.
I recommend it to you, George. It's quite surreal. You know,
Oh,
yeah, yeah. I recommend it. If you ever get chance, or any of your colleagues get chance to try
okay.
a virtual reality (VR) for short
Yeah,
uh, simulation, you might attend. I don't know, the Emergency Services show. Do you attend the
okay.
Emergency Services show in the UK in Birmingham?
Yeah, there is one that I wanted to attend, but I think that time I had a medical appointment,
Oh,
so I
bless you.
didn't manage to go. Yeah, it was, I think it was in Birmingham
That's
in
correct.
S- in September.
That's correct.
Yes, actually I was to attend, but I had a medical appointment, so I didn't manage to go.
That's fair. I didn't go this year due to work commitments, but I went the
Yeah,
year before, and they had a headset there you could try.
yeah,
So if you do get a chance to go next year
yeah, sure.
to the Minister of the show, you might get a chance to use one of the headsets if they have them there. They should do really, and you'll be able to see it for yourself how it works. It's quite extraordinary.
Okay.
I definitely recommend it to you.
I will
Yeah,
try next year, God willing.
excellent stuff. Uh, George, can you name something that you have learned about yourself during your job roles? So whether it's an advanced EMT or right now you're in the
Okay.
Ministry of Defence at the moment, aren't you? Is that right? Are you? And what's your job role with the Ministry of Defence, if you don't mind me asking?
In the military, when I came with a job role in logistic,
Yep.
but unfortunately, I did not finish my phase one training because, when we joined the military from, I don't know if you'll give me time maybe to explain
Of course,
this.
George, this is your time,
Okay,
buddy. This is your time.
okay, okay, thank you. So, when we joined military from Commonwealth, as
Mm,
per the NHS guidelines, we are supposed to go for latent TB test.
okay.
So they usually do it through blood sample collection.
Wow.
Then once they take it to the lab, if your blood tested landed positive,
Mm-hmm.
now you are supposed to go for chest X-ray.
Right.
So
Okay.
for my case, I tested landed positive. But when you test landed positive, doesn't mean that now you are excluded from the training. You just have to be given 3 months medication, but you can continue with the training
Okay.
because it's not infectious. They're just preventing.
Yes.
Yeah. So for my case, when mine was positive, so I had to be booked for X-ray. So when I went for an X-ray, there was a change on my right lung,
Okay.
upper lobe. So with that, they thought maybe I could be having an active TB.
Right. Okay.
Because based on my also exposure when I was working in the emergency, I used to handle a lot of TB cases. And also I had like COVID twice. So because it was not affecting me,
No.
because some things can only be known when you have undergone investigation.
Or symptoms, or
So
if you have any symptoms as well. Yeah.
yeah, so when I went there, when I came back from the appointment, because we usually do the chest X-ray in the Royal Marine Hospital, not
Mm-hmm.
within the camp. So I went there. My X-ray showed that I have a change in my lung, right. So when I came back, I was not allowed to go back to training. So I was isolated for 1 month. I was in week 5 actually. So I was isolated for 1 month to so that they can be able to finish investigation.
Yeah.
So that period that I was in isolation, of course, they were. doing tests. I was going for appointment with the chest physician. So, but all the tests were coming out negative.
Right.
So now, uh, I think it was around date 22 October. So since the investigations were coming negative,
Yep.
now they had to book for me a bronchoscopy procedure.
Okay.
So I went for bronchoscopy procedure. Then after some times, I started having, I started coughing blood.
Right. Okay.
So this issue started to become like on and off, on and off.
Yeah. It just seems like that.
So yeah, so it went like that, but it was not even affecting my physical fitness. I was just okay, but it's only that I would cough that blood. So this year, March, that first March, actually after my last appointment with the chest physician, it was
Mm-hmm.
on 20th March. I was supposed to have an appointment with my chest physician because that is the time that I was going to get my TB results because they had to do culture test.
Right. Of course. Yeah.
Yeah, so because it usually take 3 months. So that time I was supposed to go for my TB results. So when I went there, the doctor told me that your results are all negative.
Wow.
Yeah, but now she had even written the treatment plan now in regards to the bleeding issue. So they were like, because they had done several investigations, but there was no any infection that they would find that
Mm.
is related to my bleeding. But now the doctor, based on the images that were shown from
Yeah.
the CT scan, the doctor suspected that maybe I could be developing a condition called chronic pulmonary aspergillosis.
Oh. Okay.
Yeah, she was just suspecting,
Yeah.
and she had even written for me the treatment plan, things that were supposed to be done. Because now the TB, they had already do away with TB
Yeah.
investigation.
Yeah.
Now
That's
they
been.
wanted to focus on the issue of the bleeding.
Yeah.
So she wrote a treatment plan, things that were supposed to be done. But
Mm-hmm.
during this time, I never knew that the Navy on the other side had already made their mind that they're going to discharge me.
Oh no.
Yes. So when I came back from the appointment, I went straight to the medical center and reported about the current results for TB. So so because during this time I was stopped from training. Even my class had already passed out like
Yeah. Yeah.
last year, November. So I was just in holdover. They have a place where they normally put people who have medical issues, maybe
Yeah.
injury, and those who have failed, they are maybe those things that they are supposed to do as recruits. So you are being put there either to recover or to correct the mistakes that you failed on. So I was just there in that holding area,
Mm-hmm.
and I could go for running, I could go to the gym, swimming. I was just doing everything okay.
Yeah. Yeah. Of
But
course.
now I was put on hold because of that issue.
Gotcha.
So on 29th March, I was told that I have an appointment on Monday. That was 31st. So for me, maybe I thought that I'm going to be updated on something that is very, very important,
Yeah. Yeah.
but only to go there and being told that you have been discharged, we have discharged you because you have a chronic pulmonary aspergillosis. So I was shocked because from the last conversation with the doctor, she didn't mention anywhere that the investigation has confirmed that you have a chronic pulmonary aspergillosis. It was just a
Yeah.
suspicion,
Yeah. Yeah.
which the doctor had even written she will need like 6 to 8 weeks to confirm for investigation to confirm if I have the chronic pulmonary aspergillosis or not. But now, because I understand, military, they do what we call defensive medicine.
Right.
So they just make a decision based on assumption. But I appeal that. I did appeal that,
That's good.
and the case has been ongoing.
Yep.
And since I was discharged, now I had to come out and now take care of myself. So I had to
Mm.
look for a new GP because the bleeding was still, I was still coughing blood. So I
Yeah,
had
of
to look
course.
for a new GP, new hospital. So meaning the investigation was started afresh again.
Yeah.
So it has been like that until uh, October is when I was told that now the infectious disease department from Manchester University Hospital,
Mm.
they told me that we have done an investigation and we have found that you don't have any infection or
Right.
chronic illness and you don't have to be on any medication. So right now, your case, we will hand over it to the thoracic department because I'm supposed to go for a surgery,
Okay.
uh, lobectomy, to remove the infected area.
Yeah.
But it's not related to any infection or disease, just structural. So,
So did they
but
find
now,
out what it
sorry?
was? Did they find out what it was? What it actually was?
Yes, they said that I have a cavity.
Yeah.
I have a cavity on my right upper lobe. So that cavity, because they said the thoracic surgeon told me that there are a lot of blood vessels there which are more prone to bleeding.
Right. Okay.
So, and that is the reason why I was having that kind of on and off cough,
Right.
blood.
Yeah, that makes sense.
So, yeah, so, but the last time I coughed was on September when I had a flu. I had a very bad flu. Until then, up to now, it has never happened again.
That's
Even
good.
recently, uh, last month, I had a very bad flu. I thought maybe it will trigger it, but
Yeah,
all went well. All went well. I recovered without any
that's a
bleeding.
relief.
So,
That is a relief.
yeah. So right now, I'm just waiting because I had my CT scan on Saturday.
Hmm.
So I'm waiting now to be told when the surgery will be done in January because the last time I had an appointment with the thoracic surgeon, they confirmed that the surgery will be done in January.
Got you. So
So that has been my case.
yeah,
Because when I joined the Navy, uh, I had a plan to join the medical branch, but
yeah.
because there was no space, so I just decided to come with the logistic role. Then after some time, I will just transition.
Is there any space in the reserves?
Yeah, the reserves now you have to be here for like 3 years.
Oh, okay.
Yeah, you have now to be here like 3 years.
That's understandable. So you're just now, right now, unfortunately, it's just a waiting game, and you've
Yeah,
appealed,
then
and
now
you're
just
hoping. Yeah,
waiting game, and the only thing that I'm praying for the surgery to go on well without any complications,
we're all hoping for that for
because
you, George. We're all hoping that it goes well without any
yeah,
complications. All right, we're all
yeah,
thinking of you, and you're a very strong individual, mentally and physically. I have no doubt. So I'm sure it will go well, but we're all
yeah,
hoping that it does go well for you.
yeah, sure. Because the doctor said they will do a robotic, not the traditional way of cutting off the skin.
Right. Okay.
Yeah, as per now it is robotic, but they said unless maybe there's something, maybe depending on the issue, maybe if something warrant them to do the traditional way, they will have to. But as per now, it is robotic, of which I'm praying to God that way.
99.9% of the time, robotics work out quite well. They've been programmed to do what they need to do. They follow that program and they do it a lot
Yeah,
more better than a person would do. The only thing robotics don't have is clinical reasoning. However, that's where the surgeons who are controlling the
yeah,
robotics will come in and they have that clinical reasoning. So I think you're in good hands. I am sorry that you've gone through that and it's lasted as long as it has, and you've been in kind of
yeah, sure.
situ waiting for it all to clear up. But I hope that it does clear
Yeah,
up, and I hope that you will get through. I hope you get through the surgery well, and I hope that it clears up and you are able to rejoin the military. But
Yes,
whatever happens,
actually, right now I'm really hoping that because I still want to go and serve because
bless you.
uh, I've been that serving in the military was my dream even when I was young. But because my country, it's very hard to get that opportunity. But because UK embraces the diversity, so it was an opportunity that came, and
Yeah.
I said, let me just go with this role, and I know time will come when I will transition to medical branch.
Oh, brilliant. It's a good
Yeah,
plan. It's a good plan. And hopefully you'll be able to get there. And I have no doubt, George, if something happens where you're unable to rejoin the military, I have no doubt that you
yeah,
will find your feet. You
yeah,
have a very good experience.
yeah,
You have good life experience. You're
yeah.
wise beyond your years. From talking to you, I've noticed that. I have every faith in you that you will find your way through whatever you decide to do. Brilliant.
Yeah.
So yeah, definitely seek out 120 compressions. I think that'll help you as well. And George,
Thank you
thank you
so
for your
much.
time. Thank you so much.
Thank you for your time too, and I'm looking forward for a good new year, and we shall keep on talking and engaging.
Definitely. And I wish you a happy new year as well.
Thank
Thank
you
you.
so much, Carl. Thank you.